Chapter 5, Treatment of Anxiety. We'll skip over the terms and we'll go over them in the chapter. Anxiety disorder is the leading mental health illness and affects more than 40 million U.S. adults, according to Anxiety Disorders Association of America. In any 12-month period, approximately 18% of U.S. adults have excessive anxiety. There are 4 major types of anxiety disorder: generalized anxiety disorder, panic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Individuals diagnosed with anxiety disorders experience intense fear, apprehension, tension, or panic out of proportion to the actual threat or danger. Although most adults will experience anxiety at one point in their lives, excessive worrying and tension that are experienced daily for longer than 6 months is an indication of generalized anxiety disorder. Panic disorder affects approximately 6 million American adults in any given year. Panic attacks may be triggered by a phobia. A phobia is an irrational fear of things or situations that produce symptoms of intense anxiety. Phobias cause the person to try to avoid the thing that is feared. Agoraphobia is a condition in which people become so fearful of situations that they may produce panicky feelings, so they isolate themselves or severely restrict their activities. Obsessive compulsive disorder is a condition associated with the inability to control or stop repeated unwanted thoughts or behaviors. Individuals create rituals which they perform repeatedly to lessen anxieties about the things they fear. Post-traumatic stress disorder may develop in persons who have participated, witnessed, or been a victim of a terrifying event. According to National Institutes of Mental Health, nearly 3.5% of the adult population in the U.S. have experienced PTSD. Also, people who are sexually abused more than likely are going to develop PTSD at one point in their life. Anyone that might have went through a national disaster like an earthquake, flood, plane crash, that can cause PTSD, and depression, substance abuse, and anxiety can accompany PTSD. There are 4 major classes of medications used for the treatment of anxiety. They are SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitor, tricyclic antidepressants, which we call TCAs, and benzodiazepines. And these drugs act on the neurotransmitter Y-aminobutyric acid, which we call GABA, and serotonin and norepinephrine. And the mechanism of action for most drugs used to treat anxiety is to potentiate the effects of GABA, a neurotransmitter. GABA decreases neuronal excitability and nerve impulse transmission. Serotonin 5-HT is a neurotransmitter that plays a role in the treatment of anxiety. Norepinephrine is an important neurotransmitter for the sympathetic nervous system. It is responsible for mediating some of the adrenergic related symptoms of anxiety, like increased heart rate. Anxiety disorder is treated by the administration of anxiolytics and psychotherapy. including cognitive behavioral therapy. An anxiolytic is a drug that reduces symptoms of anxiety. Benzodiazepines are indicated for short-term treatment of anxiety. They reduce anxiety even when taken in low doses. And they are also given for panic attack, insomnia, seizure disorder, and muscle relaxation. Table 5.1 lists the benzodiazepines used in the treatment of anxiety. For all of the tables, you're going to see Canadian brands. For some reason, this book really refers to Canadian brands and statistics, which we don't need to know. The US brands are listed here first. So some examples, alprazolam. You can see all the different dosage forms and strengths that it comes in, which quite a few. Clonazepam, diazepam, clorazepate, lorazepam. And you can see that diazepam has a ton of different dosage forms, just like alprazolam. We have a rectal gel that is used for seizures. Midazolam and oxapam. So looking at that list of medications, the two common endings for drugs that are classified as benzodiazepines are apam and olam. Benzodiazepines bind to receptor sites on the GABA A complex. They promote relaxation and reduce physical symptoms of anxiety, including muscular tension. Benzodiazepines readily cross the blood-brain barrier. They are fully metabolized, and some agents are metabolized to active metabolites. The half-life of the active metabolites can be several days, which accounts for the long duration of actions of some anxiolytics, such as diazepam. All benzodiazepines produce some degree of sedation, ataxia, confusion, and reduce motor performance. They can also interfere with cognitive functions and memory because they produce a type of amnesia. The side effect is sometimes used purposely, such as when they're given to reduce anxiety associated with dental or medical procedures. They're all capable of producing tolerance and dependence, which is why they're classified as a class 4 controlled substance in the United States. Tolerance to a drug is said to have developed when the patient must take increasing doses to achieve the same effects as were achieved previously at lower doses. Tolerance to benzodiazepines can develop in as little as 14 days. They are also known to produce drug dependence. There is a lot of look-alike, sound-alike issues with anxiety medications and other anxiety medications, and then also with medications that aren't anxiety meds like Zantac or Zyrtec with the Xanax. Buspirone is currently the only azapirone drug. They're effective in management of anxiety disorders and have a benefit over the benzodiazepines because they do not produce tolerance or dependence. Buspirone is available only in tablet form. The action produced by azapirones is believed to be caused by binding at dopamine and 5-HT2 receptors. It's the only drug in this class. The onset of action is slow, and maximum therapeutic effects are achieved 3 to 6 weeks after therapy has been initiated. Hydroxyzine is an antihistamine that is also approved for the treatment of generalized anxiety disorders. It is a histamine 1 receptor antagonist. It can also be used in children and adults to reduce anxiety associated with dental and minor medical procedures. It does produce a fair bit of sedation, but similar to buspirone, it does not produce tolerance or dependence. There's two different versions, hydroxyzine hydrochloride, which is called Atarax in the United States as well, even though it just says generics, and hydroxyzine pamoate, which is Vistarol. And then you can see for the Vistarol, we only have capsules. For hydroxyzine, we have a few different dosage formulations. And when it comes to prescriptions for if the doctor just writes hydroxyzine and doesn't specify whether or not it's hydrochloride or pamoate, you definitely have to verify with the doctor. SSRIs, SNRIs, TCAs, and MAOIs are antidepressants prescribed for the treatment of anxiety disorder. Fluoxetine and sertraline are SSRIs that are indicated for OCD. Sertraline is also labeled for the use in the treatment of panic disorder, social phobia, and PTSD. Venlafaxine is an SNRI and its use in the management of generalized anxiety disorder. Clopramine, a TCA, is indicated for the treatment of OCD. So we have those antidepressants used in the treatment of anxiety listed in table 5.4. You can see some of them like fluoxetine has quite a few different dosage forms. And then we also have a dosage form just for PMS, which Prozac has been being used for. Paroxetine has quite a few different dosage forms as well. SSRIs inhibit 5-HT reuptake into the presynaptic neuron, increasing 5-HT availability at postsynaptic receptor sites. Beta adrenergic antagonists, also known as beta blockers, are administered to reduce palpitations. Rapid heartbeat is a very common symptom of anxiety. So these are prescribed to people for anxiety, usually only taken as needed. Like, oh, I'm having an anxiety attack now. I'm having heart palpitations. I need to take this medication. It is not usually given every day for this indication. Propranolol and Nadolol are the ones that are prescribed to control the symptoms that accompany anxiety and to prevent stage fright. And just kind of interesting, recent studies suggest that propranolol may weaken the formation of stressful memories, making it useful in the treatment of PTSD. However, it is not yet approved for this use by the FDA. At the end of the chapter, we have the summary of drugs used in the treatment of anxiety disorders, which we've kind of already went through. The one thing on this table that is not in the previous tables we mentioned and talked about are the warning labels. So benzodiazepines, yes, they cause sedation. So you should not drive. I mean, if you take it as prescribed for anxiety, usually people are fine. But if it's taken too much or taking whatever, it can cause sedation. And of course, every person is different. We definitely need to avoid alcohol when taking these medications, as a respiratory depression can happen, meaning you go to sleep and you did never wake up again. Of course, they're habit forming, and any extended release tablet should not be crushed, chewed, or broke. Midazolam can cause pain, swelling, or redness at the injection site. You can kind of see the pattern that's happening with most of these. May impair ability to drive, may cause drowsiness. For the antidepressants used in the treatment of anxiety disorders, alcohol can intensify the dizziness or drowsiness effect. So we definitely don't want to drink with antidepressants used for anxiety. For antidepressants, we do not want to discontinue without medical supervision.